A 35-year-old woman presents with progressive cough, dyspnea, and occasional chest pain. She notes recent skin changes, including raised, painful nodules on her legs. She also mentions a history of blurred vision, which resolved spontaneously a few months ago. Physical examination shows bilateral hilar lymphadenopathy on a chest radiograph. What is the most appropriate next step in the evaluation? A. Refer for dermatological assessment. B. Immediate lung biopsy. C. Comprehensive evaluation including history, physical examination, and serology. D. Prescribe antibiotics for suspected bacterial infection. The correct answer is C. This patient's symptoms and radiologic findings suggest sarcoidosis, a multisystem disorder characterized by non-necrotizing granulomas. A comprehensive evaluation is crucial to exclude other mimicking diseases such as infections and malignancies, and typically includes serology and possibly further imaging like HRCT, rather than immediate invasive procedures or empirical treatment. Thanks for engaging with this clinical scenario. Such cases underscore the importance of thorough evaluation in diagnosing complex multisystem diseases. Subscribe for more insights and case-based learning.